Thank you for visiting my website www.drabbasali.com. Today I would like to go over a few interesting cases. The first patient is a gentleman who had dizziness. He fainted, passed out, and he attributed his symptoms to a medication he was on, Simcor, and these symptoms did not recur. Simcor does not cause syncope. Patient underwent a nuclear stress test that showed the picture that you see here, which basically shows a diaphragmatic artifact. This led, subsequently, he had a weak heart muscle, which led to a heart catheterization. And on heart catheterization, he was found to have ejection fraction of 45%. The inferior wall of the heart wasn't moving. There was a blockage in the mid-segment of the right posterior descending artery. Patient assessment indicated that he had atrial fibrillation. He has no angina with a fixed defect, hypertension, peripheral vascular disease, and hyperlipidemia. Following this, patient underwent a loop recorder implant, and you see the loop recorder tracings. They show tachycardia, and as pondering on this case illustrates, were it not for the loop recorder, there would be no diagnosis in this patient. This is a CAT scan appearance of a loop recorder, indicating that it is placed in the skin subcutaneous layer as shown in the picture. This is what the loop recorder looks like upon implant. Here's what a fresh loop recorder implant looks like. Here's a second patient. This is a patient with seizure disorder. He had recurrent syncope. He had an EP study on account of left bundle branch block and finding of syncope. His EP study did not show any severe etiology. He had a loop implant and was followed for the next 2 years. 2 years later, the patient passed out. And as you can see on the tracing, that pause on this patient on the loop recorder was 45 seconds. In other words, had we treated this patient for seizure without a loop implant, he could have had cardiac arrest and died. Here's another example of a loop recorder patient. This loop recorder was implanted for AFib and shows that AFib truly is tachybrady. On the one side you got slow heartbeat, on the other side you got the fast heartbeat. The beats crowded together are the slow and the others are the fast. Therefore we have a thing called an EGSYS score, which has been validated. You get a point for the following conditions. If you have an abnormal EKG or a cardiopathy, you got 3 points. If you have palpitations or shortness of breath, you get 3 points. If you pass out in the supine position, you get 2 points. If your age is more than 64 years, you get 1 point. If there is no precipitating cause, you get 1 point. If you have no prodrome, you get 1 point. If you have blurred vision or neurovegetative signs, you get -1 for each. If you have predisposing factors, you get -2. If you have neurovegetative symptoms, you get -2. If you add all of these together, you get a score of 1 or greater. It implies cardiac syncope. A simpler score is the OESIL score. In this, age more than 65 gets 1 point. History of cardiovascular disease gets 1 point. History of syncope without prodrome gets 1 point. Abnormal EKG gets 1 point. A score greater than 2 implies an increased risk of cardiac death, up to 25%. Now here is a CAT scan of a different patient. This patient had difficulty speaking, and if you notice, there is a cerebellar infarct in this patient. This patient had a history of coronary disease. He had a prior MI, hypertension. He had cerebral artery occlusion with infarct or a cryptogenic stroke. Patient had a loop recorder discussion where we explained that patients with cryptogenic stroke often have underlying AFib, as much as 37% on loop implant at up to 3 years. Patient got a loop implant, and on loop check he had this finding, which is a scatter plot showing a lot of heart rate variability. The patient had underlying AFib. Then the ejection fraction of the patient was severely decreased, estimated 15%. Patient was in AFib. Patient then underwent AFib ablation. When he was back in sinus rhythm, his heart function recovered very nicely. So here's another instance of a loop recorder that changed the diagnosis completely and helped the patient avoid future stroke, and his heart function was regained with AFib ablation. So these series of cases explain how a loop recorder would completely change the treatment and management of a patient. Thank you once again for visiting my website, www.drabbasali.com. Thank you.